Hi, everybody. This is Denis Godlewski, and this is ITPC Eastern Europe Central Asia podcast. And we're here on the fourth day of the AIDS conference with Imonn Merfi, the regional director for the regional support office for Eastern Europe and Central Asia, and as well for Asia Pacific.
That's correct, yes.
And we really appreciate you finding the time. Thank you.
It's great to be with you, Dennis.
How was your conference so far?
It's been very good. It's been very dramatic with the new news on long-acting injectables. But for us, from the region, it's been dynamic. To have it in Munich has given such visibility to the issues that are affecting our region.
Do you think that Eastern Europe and Central Asia was reflected properly in the region? Because it was announced that Eastern Europe and Central Asia is a priority for this conference. Do you think they managed to achieve the goal?
I think so. I think the visibility and it helped having in the opening someone from the region speaking. So Andre raising issues from the region. But throughout the conference, I've seen the visibility much higher than we would see it elsewhere. Right? And being here meant more people could be in attendance in person. So I think that's really helped. And many of the sessions I've seen either targeted or representatives from our region involved.
All right. On the first day of the conference, UNAIDS launched a new report, and I think the name of it says a lot, The Urgency of Now, AIDS at a Crossroads. And I would like to ask you to explain to those community members who were not able to make it to this conference, what is it about and what are the key conclusions of the report?
Okay, thanks. We did a regional launch here at the conference as well for Eastern Europe and Central Asia. And so that added to the power of being able to get it out because we had media from the region here as well as senior representatives of the region. Normally it's online, it's nothing like that. So that helped get us a lot more attention. The challenges of the overall report, it's not just for the region, of course it's globally, is that in some parts of the world we're on track and we're doing extremely well. Treatment coverage has gone from 47% in 2010 to 77% today. So that's a 30% increase. But that's not the case for all regions. And that's a significant issue. In the report, we see for the first time ever, new infections outside East and Southern Africa are now much higher than those in that region. And so we're seeing a shifting dynamic in the epidemic. And it reflects resources and political commitment in other regions and changes that we're seeing. So we're seeing rising infections in some parts. The lack of investment in programs for key populations is also strong and clear. From an Eastern Europe, Central Asia point of view, we are the only region with increasing death rate, a 34% increase over the period since 2010. Yet every other region in the world has gone down. The global average about 51%, and some have gone past that. And so that's another significant message for us. In our region, countries are not providing the treatment for the people who need it, and people are not getting into services.
So basically, what you're saying is that we are the only region, I want to highlight that, where the death rates have increased, and in all the other regions it has decreased.
Exactly.
And what about the treatment uptake?
Well, that's another issue. When we've got over 2 million people in need of treatment, and less than 50% are able to access treatment. So this is a significant issue. So if we've got a gap of 50% in those who need to access treatment, it says something about our programs are not right to get people in and then to have sufficient resources and treatment available. But I really am concerned that the number of late diagnoses of people who are coming into treatment suggests it's a lot more to do with people being either afraid or unwilling to come into services for a whole range of other reasons.
So basically, to me, it also says that we really need to work on our kind of testing program and where we test and whom we test, right?
And how we test. Expecting people today to come into a fixed site clinic is not necessarily the way to go. Self-testing, community-based testing, that has a higher yield. And it's not just in our region. I was in China the week before the conference, and there they're talking about shifting and increasing the proportion of community-based testing through community organizations because they see a much higher yield in people going in for testing and results given than they do through the clinic approach, right? So we need to look at changing the model.
So if we turn these problems into the solution, what UNAIDS recommends to countries in this report, and in particular, maybe you could amplify something for Eastern Europe and Central Asia.
Well, firstly, an investment in prevention. We need to see governments increase their investments in prevention. Can't treat ourselves out of this epidemic with the level of investments we have today, and particularly for Eastern Europe, Central Asia. That's quite clear, as we discussed earlier. So prevention has to increase. The engagement of the community is in the service provision and encouraging others and supporting people on treatment. But that means we have legal reforms that need to happen, because one of our biggest barriers in our region is the actual use of the laws that are criminalizing transmission or risk of transmission to other people. Some parts of the world have these laws, but they haven't been used. We have cases across our region where they are used, or the threat of the law is used against people to keep them away from services is the result. So we have to change this. These legal frameworks have to be replaced.
May I clarify something here? Because I keep hearing this even from people living with HIV. They say, well, I want to have a tool to be able to hold somebody accountable if he or she infects other people, and the people must disclose their status to their partner. What would be your response to this kind of thinking?
Well, one, it's old thinking in many parts of the world. It's not the way we look at it today. People should disclose, yes. If you're in a trusted relationship with somebody, you should be telling them about your HIV status. You should be taking precautions to prevent HIV transmission. But we should also understand, if people are on treatment and are adherent to their treatment, then they can't pass. And WHO, the World Health Organization, has confirmed the U equals U, zero transmission if your viral load is undetectable. And that's another reason why we've got to get people into treatment. People are afraid to get into treatment for a whole range of other reasons, to get tested, to access. But we've got to turn that around. We've got to get governments and others to get out there and explain to the community, HIV is not a death sentence. It should not be. In our region, for some, quite obviously it still is. But we should have the treatments available and the testing and the support to people, get in treatment, get the viral loads undetectable, then they can have a normal life, right? And then we don't have the level of fear. So, but punishing people for their HIV status or their lack of knowledge, if we have women in some countries being sent to court and even jail because they passed HIV to a child and they only knew when they were tested in the clinic when they were pregnant and giving birth, right? Now, they didn't know that. So why should they be punished, right? Now, you do have extreme cases of others, but that's different. That's usually covered by other laws, right? So if someone is knowingly doing it, that's a different story, but people are not doing that. No?
Yeah, I think people are underestimating in our region the fact that in most of the countries we already do have a law that is related to public health threats, and there is no need in specific HIV law. The other aspect of it, before we go back to the recommendations for the government, so the other aspect that I want to unpack is AIDS denialism, because the case that you have brought up for a mother and a child, I think it was like Russia, but I'm sure there are many other countries where these cases have happened, that people being under the influence of AIDS denialists don't give their kids treatment, and, don't treat them, and so on and so forth. And the public opinion on this quite often is like, oh, like, unfortunately, kids even die. This is a very tragic event, as you said, but it happens. But the public opinion is like, well, these people are insane and they should be punished. So what do you think of this? Which is close, but it's a little bit different angle.
It's different, and this relates to community stigma and discrimination and fear. And I saw a really powerful display here in the Global Village, and it's from our region. And these are young people telling their stories. And there was a young boy telling his story, doesn't show his face.
Okay.
And he says he and his mother both have HIV. He wants to continue his life journey and his aspirations for life, but they live with a closed face. And what he meant by this is they hide their HIV status. And you're right, there are some people who are so afraid of what's going to happen to them and their children if they disclose that they leave it too late. either for themselves, because there was another story in this display where the father was so scared about seeing his son die before him of HIV. And these are people who have acquired HIV for a whole range of different ways, right? And the issue here is that they're afraid of the community reactions to their HIV. Again, it goes back to the modern understanding of the treatments we've got available today. You get someone on treatment, a child or an adult, they can live the same lifespan as other people, but we've got to get them into treatment. So what's holding them back? That's the question to ask people. Why are you making it so hard for people to feel comfortable to speak out about their HIV, to access services?
Yeah, I think it's a great answer. So back to the recommendation. So you said prevention needs to be
treatment
laws.
Scale up. The laws have to be changed.
Yeah.
That's just stopping everyone from accessing either prevention, testing, or treatment. And that's going to continue growing our epidemics in our region. And that we can't have. Not in this day and age. What are we saying to the people of our communities if we're not able to provide them the same services you can get in Africa or any other part of the world, right? So that is a real shame for the leaders across our region, I'm sorry to say, that we have this situation. And the report is very clear on this. And the data comes from the countries.
Yep.
Right? It's not UNAIDS data. This is country data. And in countries, they recognize some are trying to make changes and do things about it. So it's not all negative, but we have some serious changes that need to happen. Prevention is one. Access to the testing, the types of testing, getting the treatment available to people, same day access, not having the complicated processes of, in some cases, it can be months before someone can get into a treatment program, and often the loss to follow-up happens in between. We have to make it easier for people to access treatment quickly and stay in treatment and have support. So again, this comes to some elements, maybe costing is an issue for some, so we have to look at how the access is done, maybe pooled procurement, but largely it's about government prioritization of access of services, of all services.
I also need to stop you here, and I'm gonna be a devil's advocate, because now from the perspective of the clinicians, I often hear that in the region. Well, yes, the importance of rapid initiation of treatment is very important, it's no doubt, but we don't have to be in too much of a hurry. And same-day treatment initiation, that might be a little bit over too much, because we need to explain person about the pills. We need to make sure that he or she is adhered to treatment. He needs to understand the series of the, well, sorry for my English, the condition and how severe it is, and that he or she needs to be also very responsible towards the treatment. Otherwise, they're just going to skip, and there will be no adherence, and it's going to cost us extra because we'll switch him or her to second line. How would you address that?
Well, that suggests a rather high level of arrogance on the part of the clinicians to assume that the people who need to take treatments are not going to invest in protecting their own lives and the lives of their families and their communities. That pill training, the pill testing, the treatment, that's so last century. I've heard of that in the past, but I don't hear of that other places now. It's usually about a supply issue is what delays people in other countries. If it's about not trusting the patients to be able to take medications to protect their lives, that says something about a level of stigma and discrimination in the health system that needs to be addressed. If people are coming in with late-stage illness, they can't wait months to get into treatment. We've got to get them into treatment immediately, regardless of their CD4 count or their stage of illness. And particularly given the high levels we have in countries of late-stage illness on diagnosis. And that's part of it. They've got so sick, they overcome their fears of everything else, and they go for testing. So we should have had them tested much earlier and in treatment much earlier before they get these late-stage illnesses.
Perfect. What would be the plans of UNAIDS with regard to the conclusion of your report? What UNAIDS as an institution going to do about it? How are you going to prioritize?
Well, the title of the report, The Urgency of Now, this is a critical issue, and we discussed this in the panel when we launched it at the regional level. There are pathways to go. There's the right pathway, which is looking at the issue of sustainability, which is unfortunate, but we need to be looking at sustainability for the future of the programs, which means political leadership, the right programmatic mix, to make sure that the programs are going to be sustainable and affordable at country level, and the resourcing for it. Not expecting to be dependent on international resourcing in the future. So this is a critical issue that countries have to address. But the fundamental issue here is all people in all our societies should be able to access the healthcare they need, regardless of any condition, type of disease, or any other factor. And that is usually enshrined in the legislation or the approach to health in all our countries. So we need to get over that. It's the same for tuberculosis or any other disease, right? We should not see HIV in a different way to any other disease, because it feels like a blame game is going on, right? So we would need to work with our partners, the World Health Organization, community organizations, supporting governments, and there are a number of governments putting in place the right programs. It's the scale is the issue. So if you're introducing some of the new technology for prevention, and we've heard here today at the conference and over the course of this conference about the injectables, that's going to be a big game changer for our region. Prices have to come down to make them affordable, that's a given. But if we can get injectables of 6 months for either treatment or prevention, that's going to be significant, but we need to be ready for that. So that means we need to change the testing, get people into treatment early so they can benefit from this. And then we can change the epidemic. It is quite possible. But prevention is going to be the other critical thing we have to continue working with governments on. And those governments who are able to encourage others to make the legislative change or the programmatic reforms, we need to get behind and work with peer-to-peer learning from governments. Because we have changes happening positively in the region, at the same time some negative programming and negative legislation.
Would you be able to highlight any of those positive changes, something that really struck you, maybe that you have seen at this conference or recently?
Countries?
No, country-wise, or just the practice that you think?
Okay. The practice of pre-exposure prophylaxis is one, and where we have countries in our region that are introducing it. And that's critical, because if you can give someone a way of protecting themselves from acquiring HIV in the first place, it saves the country a lot of money, it saves the people a lot of trauma in their health and their situation and their families. That's important. We need to also see those countries that are supporting opioid agonist therapy. The treatments for heroin dependency is incredibly important for us to see scaled up, and we're not seeing that everywhere, but we are seeing it. The need outstrips the availability. But so those, and then we do have countries where the testing is improved significantly and the treatment coverage, where governments are moving to provide coverage. In some countries in our region, we have 96% of treatment is covered by the government budget. So it can be done. Right? So
what would be those countries?
Armenia is an example that comes to mind immediately, where the coverage level of 97% this year of treatment, and they are providing treatment free to people who are not Armenian citizens, who are in the country for a whole range of reasons. And so we need to see others following that model, because in our region people are moving, they're migrating for work, short-term, medium and long-term. Some go home, and HIV is a risk factor for the family at home. So we need to make sure we're providing treatment wherever the person is. And so we need intergovernmental support for that. But the other important thing that we're seeing, where countries have used in partnership with community to access the communities and get testing out and education and services, they are having more success than other countries, which are relying on the old-fashioned models.
I want to stop a little bit on PrEP, and you've mentioned the incredible results we have heard today. And you said, of course, the prices should go down. So what is the regional office or UNAIDS in general position on the price reduction? Is UNAIDS doing anything about it?
This is price reduction in our region is a challenge, not just in our region, where countries are getting to the middle income status. This is where they hit it. Another country example I think of outside our region, but Malaysia, which was doing really well. Their treatment levels dropped. They got middle income status. The price per patient went up. So how do you adjust that? And of course, social sectors, education, health, they're not the first to get a boost when the economy is going. It's about building the economy. So they're always well behind. So we need some of the international partners to understand that. European prices are not relevant in our region. So we need to see some, probably between countries, doing some pooled procurement. But this is something we need to work with the World Health Organization and other organizations to do. That's a lead that they have more than ourselves, but we are advocating for it. And we're going to need to look at that again with these long-acting injectables for treatment and for prevention. I think to get the demand levels up, to get the prices down, we may need countries to work together and look at how to procure jointly. So we need mechanisms for that. So there's work to be done in the next couple of years on this.
And I find it personally extremely important because together with the excitement of the lenacapavir data, I think the data that Professor Andrew Hill has presented here, that the coverage could be, that the costs could be as low as $40 per patient per year if the scale up is there. I think it's amazing. It's unbelievable.
I used to work in the government in the health system, looking after HIV and other communicable diseases. If I could bring the price down in the sense of not having a patient come to see me every month or every 2 months and give them an injection once every 6 months that's going to keep them healthy and going to get viral load suppressed so there's no further sexual transmission of HIV, that's a major saving to my economy, my budget, right, that I can use for other programs. So that's why we've got to get behind it. And governments in our region should be seeing this as a cost saving. But that's, again, why we have to get demand down. But the prices, if we have to get it out through generics, and we have to get special licensing done if that's the issue for a country, and get the price down. Then it'll save a lot of money for the health programs.
No doubt, no doubt. Thanks. I always close with some personal questions. How many years it's been since you've started your work in public health?
Well, you can tell by the grey hair it's been a few years. I started in
rough estimates.
I started in the 90s in Australia working on this.
So it's over 30.
Yeah, over 30 years. In the earliest days of HIV, I saw it happening, saw someone in a workplace I was in. I wasn't in an HIV or a health workplace, and I saw someone become ill, and they talked about a blood issue, right? And the stigma and discrimination this person faced because of the fear in those days has always stayed with me, and it's been part of the motivation for me is about how to help people help themselves, empower them to look after their own lives and deal with these social aspects of disease programs. So my public health training was happening at the time, and I moved into the government. So I've been working on that in Australia and then across the region of Asia and in Geneva, but now I'm very pleased to be working in Eastern Europe and Central Asia. So it's over 23 years with the UN on these issues, just on HIV.
Our work can be overwhelming. It's very often like you keep saying every meeting, every year, same things, and the change is sometimes very slow. It's the burnout that happens and tiredness. What keeps you driving today?
Well, the first pre-conference of this conference was with young people, and that motivates me. We see young people fighting for their opportunity in life. Some things have hit them hard. Some of them got HIV and they didn't know they were getting HIV, either through their parents or through other ways, but they fight back on it. We have to give them a chance. To me, it's about what motivates me is seeing those glimmers of success and change in people's lives and the improvements we've had over time, where the illness and the impact on people's lives is different with the new treatments. So there are times where it's hard, I have to admit, where you see some really significantly bad decisions impacting on people's lives for no good reason, right? But then you also see the great change that comes about and how people's lives can be enriched and they're empowered to help other people. And that social change of empowering people to take care of their lives, their health, as part of their lives and supporting each other is really powerful for me. I don't care what background they have, what their risk behaviors, what communities they're from. It's about our people, our communities. Think of our children in the future. We want them to lead better lives than we've had. And that's what motivates me, the social change.
Any other message that you want to send to the communities that will be watching this in a couple of weeks from now?
The communities in Eastern Europe and Central Asia are key to our success. And they're powerful and they have been vocal. We need to maintain that. We need to continue keeping us accountable, keeping governments accountable, making sure the right programs are in place and asking why they're not. And I'd have to say, when I compare the two regions I work across, in Eastern Europe, Central Asia, community is powerful. They have a strong voice, but we need to support them to protect that voice so that they can call for the needs and make sure we get the right program. The other key message is governments need to understand this can be resolved. We can address and sort HIV out in this region, but which pathway are we going to take? They need to make that decision now. And it's quite straightforward. The report and many other from all different organizations show the right ways to move.
I think it's a great closing note. Thank you so much, Imonn. Thank you. Appreciate it.
Thanks.